All right, all lung bases are clear, no adventitious sounds. She doesn't appear to be any distress while breathing. Respiration rate is about 18 to 20. We'll reassess in the back. And now we're gonna listen to the heart sounds. We're gonna listen to the apical, pulmonary, Erb's point, tricuspid, and mitral valves with the diaphragm first, and then we're gonna listen with the bell. And with the bell, we would be noticing if there was any murmurs or gallops. So we're gonna start the first one. You can breathe regularly. Sorry. All right, and now we're gonna listen with the bell. All right, S1 and S2 are noted, regular rate and rhythm. No murmurs or no gallops are noted. We're gonna move to the back. We're gonna start by just assessing. We're gonna also assess the scapula while we're here. Can I ask you just to reach down and touch your toes really quick? We're just gonna look to see if the spine is symmetrical and there's no showing of scoliosis, all right? And we're going to just palpate really quick. Just tell me if you have any tenderness. Any tenderness? No. All right, while we're here, I'm gonna put my hands on about the 10th rib, and I'm gonna ask her to take one deep breath, and we're gonna see if her lung span is symmetrical. All right, you can breathe in. Okay, release. All right, it's symmetrical. Up, and we're going to percuss. We're gonna listen for resonant sounds. Can I ask you to just pull your arms forward just a little bit, just so I can get your scapula out of the way. Now we're just gonna listen. Take a deep breath. All right, no adventitious sounds noted, all regular rate and rhythm. And if I were in a scenario where it was just the privacy of me and the patient, I would have actually put the stethoscope on the skin of her chest so that way I can hear all sounds, and making sure that I'm ruling out not having the stethoscope on her clothes and making sure I'm hearing everything correctly. But for the purposes of this is why we have just a jogging bra. One on top of it. All right, I'm just gonna ask you to lay down really quick. And before we start the actual stomach, I'm gonna just look at the neck again. We're gonna revisit the JVD, and we're just looking to see if there's any jugular vein distension. We're looking on both sides, and I'm just gonna ask you to just kind of sit up really quick. This spine's at about a 30-degree angle, and I don't see any JVD distension on either side, so now I'm gonna ask you to just lay back down. All right, awesome. So now we're gonna start with the abdominal area, and we're gonna look for any pulsations, any hernias, any lesions, any mass, if she had any wounds, if she had any G-tubes. And before we do anything, we're going to auscultate. We're going to auscultate with the bell, and we're going to listen for any bruits. So we're going to start with the abdominal artery. We're going to do the renal arteries, and we're going to do the iliac. I'm just going to pull that a little bit, which is about right here. Okay. no bruise or note it. And now I'm just gonna listen with the diaphragm. I'm gonna listen for her vowel sounds. Sorry, got all tangled. All right, we're gonna listen to all 4 quadrants going in clockward motion. Alright, vowel sounds noted in all 4 quadrants. We're going to do a light palpation. We're going to see if we feel any rigidity. We're going to also see if she has any tenderness. So just let me know if you have any tenderness, okay? We're going to start with a light palpation. Any tenderness?
Nope.
Alright, now we're going to do a deep palpation, okay? Feeling for the same things. No pain?
Nope.
Alright, so no pain, no rigidity. We're also now going to percuss we're going to do the liver, which is on this side, and then the spleen, we're listening for tympanic sounds, and if there's any dual sounds, it would show that there's probably fluid. Okay. Alright, listen to this again. So spleen and liver, tympanic sounds were noted. I'm going to ask you to just close your eyes really quick before we stand you up. I want you to just let me know whenever you feel me just touching you. All right, it's for sensation. So.
No. Yes. 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 Yes.
All right, so sensation is normal on both sides. I'm going to ask you also, you can open your eyes now. I'm going to ask you to grace your heels because we're looking for the neurological part. I'm going to ask you to put your feet at the base of your foot, and I want you to go up and down your shin. You can do 1 foot at a time. Yeah. All right, perfect. I'm going to ask you to just sit up really quick. And then you can stand. We're going to do the Romberg's test. We're looking to see if she has any swaying. We're looking for her balance. So, yep, you can close your eyes now. We're going to look for any swaying. All right, no swaying, note it. You can open your eyes. I'm going to ask you to just walk to the door. We're looking at her gait right now. All right. And then I'm going to ask you to just walk back to me heel to toe, though. Okay, now you're going to do that one again. Just walk back to the door, heel to toe. Amber, like this. Heel to toe, like this. Yeah, like that. Now you can come back doing it. All right, we're looking at balance and coordination at this time. All right, which is intact. All right, well, thank you for being my patient. And the consents are going to be submitted. Thank you.